Hello folks, and welcome to this week's presentation. Today we'll be talking about neurology, which is a little bit extensive, but I personally find rather interesting, fascinating actually, the whole network of what causes the body to work. So just going over some of the learning objectives, we're going to start off with basic anatomy, physiology, and disorders of the nervous system. Number one, we want to summarize the anatomy of the nervous system and compare the structures and function of the nervous system across the lifespan. Discuss the cells of the nervous system and describe how they work, understanding these terms of polarization, depolarization, and repolarization. If you've taken anatomy and physiology already, you may be familiar with these terms. We've also discussed these terms in EKG class. Describe the autonomic nervous system, including the sympathetic and parasympathetic nervous systems, which is going to be a very important concept to go over again and again and again because it's going to play a part in learning about cardiac issues, pharmacology, EKG, all sorts of things. Distinguish among common neurodegenerative diseases, such as dementia. Discuss various functional disorders and describe the three types of seizures. Compare and contrast encephalitis and meningitis. Just a few of these problems we're going to talk about. So, neurology is in healthcare a specialty that deals with diseases and disorders of the nervous system, including the brain, spinal cord, and all the peripheral nerves and wiring of this network. A neurologist is a specialist involved in diagnosing, treating, and hopefully preventing nervous system diseases and disorders. Besides the neurology department, patients with nervous system concerns can be seen in primary care to begin with, also can be seen with some issues in urgent care and emergency departments. The medical assistant may be involved with helping the provider in any number of these venues, and should also be helping with examination and screening questions. So the main structures of the nervous system include the brain, the spinal cord, and the nerves. Simple as that. Various other sense organs exist through the body, such as the eyes and the other sensory organs. But the nervous system is made up of nerve cells. So the basic unit of the nervous system is called a neuron, or nerve cell. Neurons will be discussed a little bit later. Now, you can divide the nervous system anatomically into two divisions. That is the central nervous system, which is composed of the brain and spinal cord. And then there's the peripheral nervous system, which is made up of all the nervous tissue outside of the central nervous system. This includes 12 pairs of nerves that come right off the brain, called the cranial nerves, and 31 pairs of spinal nerves that come off the spinal cord. Now, the peripheral nervous system can also be subdivided physiologically into two separate sections. The somatic nervous system, which is voluntary, and it collects information from and returns instructions to the effector organs, such as the skin, muscles, joints, and sensory organs. Then there's the autonomic nervous system. Now, if you look at the word autonomic, it kind of sounds like automatic, which is involuntary. It collects and returns information to the involuntary structures of the body, such as smooth muscles, glands, organs, just to name a few. So the brain is enclosed in the skull and is one of the most complex organs of the body. It's also the most important and well protected organ in the body. The body, when undergoing stress, will sacrifice just about any other organ system to preserve and protect the brain. It's divided into the cerebrum, the cerebellum, the diencephalon, and the brain stem. The cerebrum is the largest part of the brain and is divided into two hemispheres, or two sides, by a deep fissure. The right hemisphere controls artistic functions such as drawing, rhythm, picture memory. The left hemisphere controls verbal functions such as reading, writing, speaking, and mathematical calculations. So the way I always remember that is just thinking about how artists are the only people in their right minds. The hemispheres are connected by a structure called the corpus callosum, which is a bundle of nerve tissues that facilitate communication between the two sides of the brain. If the corpus callosum is only partially developed or is absent, person may be diagnosed with something called corpus callosum agenesis. Most of the signals between the brain and the body cross over. That means the left cerebral hemisphere primarily controls the right side of the body. The right hemisphere primarily controls the left side of the body. There's only one or two exceptions in this instance. So if a person has a stroke on the area of the right hemisphere, the symptoms will usually be seen on the left side of the body. Now, each cerebral hemisphere is further divided into 4 sections called lobes, and they're as follows. There is the frontal lobe, which lies directly behind the forehead, and this lobe has primary responsibilities for personality, intelligence, concentration, self-awareness, problem solving, short-term memory, planning, judgment. In the back of the frontal lobe is the motor area, which controls or initiates, I should say, voluntary movements on the opposite side of the body. The Broca's area is found in the left frontal lobe, which is involved with speech. When damage occurs to the Broca's area, a process called aphasia, or difficulty speaking, can occur. The parietal lobes are found behind the frontal lobes. These lobes are involved with reading and interpreting visual, auditory, motor, sensory, and memory signals, along with spatial and visual perceptions. The sensory areas found near the motor area of the frontal lobe receive information from the body regarding touch, pain, and temperature. Reading and math skills are also functions of the parietal lobe. The occipital lobe, found in the back of the brain, the occipital region of the skull. These lobes handle images from the eyes and interpret visual input, connect the information with stored image memories. Damage to or lack of these lobes can cause blindness, even if there's no issue with the eyeballs themselves. The temporal lobes are found in front of the occipital lobes on the right and left side of the brain. The top of each temporal lobe receives information from the ears, and the underside of the lobe forms and retrieves sound-related memories. An area called the Wernicke's area, found in the left temporal lobe, is important for language comprehension and speech. The temporal lobes are also responsible for processing memories and sensations of taste, touch, sight, and sounds. The amygdala is found in each temporal lobe and is involved with the limbic system. Now, the cerebellum is a little less complicated than the cerebrum. It's located below the occipital lobe of the cerebrum. It's also covered by the cortex. The cerebellum gathers input from other parts of the brain, and spinal cord provides accurate timing for coordinated, smooth movements. The cerebellum also coordinates the equilibrium or balance, posture, and muscle coordination. Damage to the cerebellum, which can be caused by a stroke or a Parkinson's disease, can cause nausea, dizziness, balance and coordination issues, and loss of fine motor function involved in doing specific tasks. The diencephalon is located just above the brainstem and is almost surrounded completely by the cerebral hemispheres. It serves as a relay station for sensory input neurons and other parts of the brain. It plays important roles in the functioning of the central nervous system, endocrine system, and the limbic system. The diencephalon is composed of the posterior pituitary gland and the pineal gland, which is part of the endocrine system. Also has 2 other parts: the thalamus, which processes information going to and from the body and the cerebrum, and the hypothalamus, which controls body temperature, hunger, thirst, and is also part of the limbic system. Attractive nerve cells connects the thalamus and hypothalamus to the hippocampus. The hippocampus works with memories, sending memories to the cerebral hemisphere for storage or long-term memories, and then retrieving them from needed, such as getting something off of your hard drive. The brainstem is the most critical part of the brain, which connects the cerebral hemisphere to the spinal cord. It controls the flow of information from the body to the brain, and it is composed of several sections. The midbrain connects the hemispheres of the cerebrum with the pons. It serves a relay center for auditory, visual, and motor information. It also contains centers to regulate pupillary reflexes and eye movements. The pons serves as a bridge between the medulla oblongata and the cerebrum and helps regulate respirations. The medulla oblongata is the lowest part of the brainstem. It contains the vital centers of life. In other words, the cardiac, respiratory, and vasomotor centers. That regulates the heart rate, respirations, diameter of blood vessels, all of which affects blood pressure and perfusion. Some non-vital centers are also found in the medulla oblongata, including centers that regulate coughing, sneezing, hiccuping, vomiting, and swallowing. Some medications work to quiet these centers, but by and large, you cannot live without a functioning brainstem. You can pretty much take out half of your cerebral cortex and even half of your cerebellum and still live a somewhat functional life. There is no life without a brainstem. The spinal cord is a bundle of nervous tissue. It extends from the medulla oblongata to about the second lumbar vertebrae. The spinal cord passes through the foramen magnum, which is the only hole at the base of the skull, which allows for exiting of material, and the skull, and is protected by the vertebrae. It's covered by the meninges, or the meningeal layers, which we'll talk about later. Spinal cord is composed of the cell bodies of motor neurons and myelin-covered axons. There's 31 pairs of spinal nerves that extend down the spinal cord. Each nerve stimulates a specific organ or area of the body. The spinal cord carries messages between the spinal nerves and the brain, and this process can slow down with aging. Speaking of aging, there are certain lifespan changes that occur in the neurological system. So infants are born with an immature nervous system. Over the first few years of life, the process of what's called myelination continues, causing an increase in the child's brain size. The myelin is the protective covering that surrounds the axon terminal, or the sending information of a nerve cell. As a child matures, learning and thinking processes become more complex. During adulthood, the brain function is stable, at least in most people. As a person ages, the nervous system starts to change. The brain and the spinal cord start to lose nerve cells. Nerve cells break down in the brain and waste products tend to accumulate, which can cause things such as plaques and tangles, or bunches of nerve fibers to form. Nerve impulses become slower. This causes a slower reaction time. Tasks may take longer to perform. Reflexes can be reduced. Slowing of thought, thinking, and memory is also a somewhat normal part of aging, although it can be staved off for quite some time with healthy living habits. The meninges are membranous protective coverings that surround the brain and the spinal cord. They help anchor these structures in place, provide nourishment and protection. They're composed of three membranes. There is the dura mater. The dura mater is the outer layer of meninges made up of tough white fibrous connective tissue. Space below the dura mater is called the subdural space, which contains tiny blood vessels. Head trauma can cause these vessels to bleed, causing something called a subdural hematoma. And below that is what's called the arachnoid mater, or sometimes just called the arachnoid. It has this name because its thread-like strands give it the appearance of a spider web. This is the middle layer of meninges. The space below the arachnoid is called the subarachnoid space, and it's filled with cerebrospinal fluid and blood vessels. Cerebrospinal fluid we'll talk about in a minute, which helps bathe and nourish the brain. And then the pia mater, which is the innermost layer of the meninges, is a very thin, highly vascular membrane that is tightly bound to the surface of the spinal cord and the brain. It very tightly adheres to all the turns and twists and folds in the brain tissue itself. The ventricular system in the brain is made up of four connected ventricles, or spaces, just like the heart has four ventricles. Your cerebral spinal fluid originates in an area called the choroid plexus in these ventricles. CSF, cerebrospinal fluid, is a clear fluid that resembles water and has three major roles. It cushions the brain and the spinal cord. It removes waste products from cerebral metabolism, such as acids, and helps supply nutrients to the nervous system tissues. So the CSF flows through the ventricles, exits into the cisterns at the base of the brain, and then moves around the brain and spinal cord. Eventually, it's reabsorbed into the bloodstream. The balance between CSF production and absorption is critical. Excessive amounts of CSF result in abnormal widening of the ventricles, where it can put pressure on the brain tissue and lead to a condition called hydrocephalus. If you ever known a child that had a condition of hydrocephalus, you know that their heads can grow disproportionately larger to their bodies, and they can have various types of motor and nervous impairments. Now, the peripheral nervous system is made up of the nerves that exit the brain or spinal cord. The peripheral nerves exiting the brain directly through the skull are called cranial nerves. The cranial nerves originate from the underside of the brain and relay information to and from a bunch of sensory organs and muscles to the face and neck. They can either have motor function, sensory function, or both. Now, your textbook lists all 12 cranial nerves, where they're found and what their function are and what their names are. You are in no way, shape, or form required to memorize these nerves. It's very difficult and beyond the scope of what we really need to do. Spinal nerves exit the spinal canal through the spaces between the vertebrae. Spinal nerves closely mimic the organization of the vertebrae and provide stimulation to the rest of the body. If the nerve fibers from several spinal nerves form a network, it's called a plexus, like the brachial plexus. Spinal nerves are named by their vertebrae location, for example, cervical, thoracic, lumbar, etc., and by number. Spinal nerves carry information to and from the brain through the spinal cord. The sensory fibers in these nerves carry stimuli from the skin and internal organs to the central nervous system. The motor fibers carry messages from the central nervous system to the skeletal muscles, causing them to contract. Although you do not see the term listed here on the slide, it's important to be familiar with the term dermatomes. Dermatomes are skin surfaces areas which are supplied by a single afferent spinal nerve. These areas are so specific the body can be mapped out by these dermatomes. I suggest you look in your textbook at the demonstration. Shingles, for example, appears on a specific dermatome based on which nerve the virus is infected. Now, the peripheral nervous system also makes up part of what's called the autonomic system. The autonomic, or as I said before, automatic nervous system controls homeostasis, and helps keep the body running smoothly. Now, the physiology of the nervous system is a very complex system that plays a major role in homeostasis, or regulating the day-to-day activity and environment of the body. The nervous system works in partnership with the endocrine system to help the body respond to its internal and external environments. This effort is responsible for communication and control throughout the body. There are three main functions to the nervous system. 1. Collecting information about the external and internal environments, sensing. 2. Processing this information and making decisions about actions, interpreting. And 3. Directing the body to put into action the decisions made, acting. For example, the sensory function begins with a stimulus, such as the uncomfortable pinch of a tight shoe. That information travels to the brain where it's interpreted, such as pain. The return message is sent to react to the stimulus, remove the shoe. To carry out its functions, the nervous system is divided into two main parts, as we pretty much mentioned before. The peripheral nervous system is composed of the cranial and spinal nerves. This consists of voluntary and involuntary nerves, which may be afferent or sensory, which carry impulses to the brain and spinal cord, or efferent, or motor, carrying impulses from the brain and spinal cord to an organ, gland, or muscle. The central nervous system is composed of the brain and the spinal cord. It's the only site of nerve cells called interneurons, which connect sensory and motor neurons. The nervous system is made up of two types of cells. There are neurons, which are also called parenchymal cells, and these carry out the work of the nervous system, and neuroglia, or neuroglia, which are called stromal cells, or glial, and they provide a functional support, structure support for the neurons themselves. So the basic functional unit of the nervous system is the nerve cell, or neuron. A neuron is composed of a cell body, dendrites, and an axon. The dendrites are the short projections off the cell body. They pick up the electrical impulses, say from other neurons, and send the signals along the cell body. The impulse is then passed to the axon, which is the long extension off of the cell body. Some axons can be over 3 feet long. The axon transmits the impulse to other dendrites, glands, or muscles, which are called the effector organs. An action potential is a self-propagating wave of electrical impulse that travels along the surface of a neuron membrane. An action potential proceeds in the following steps. First, a stimulus, starts an impulse. Then the resting nerve cell has a slightly positive charge due to the sodium ions on the outside of the membrane and a slightly negative charge in the inside of the cell. This is called polarization. When a section of that membrane is stimulated, the positively charged ions on the outside of the cell enter the nerve cell. This changes the outside charge to negative, and this is called depolarization. Almost immediately after this impulse passes, the positively charged ions move outside the nerve cells again. This returns the outside charge to a positive charge. This is called repolarization. Once everything changes back, the cell is at rest again, and the cycle continues. The transfer of the action potential begins as the electrical impulse travels down the axon. It becomes a chemical impulse while moving across the synapse, which is the gap between the neurons. The transfer of impulses from the end of one neuron to the dendrites of another is enhanced by chemical neurotransmitters found in the synapse. Examples of neurotransmitters include epinephrine, norepinephrine, dopamine, serotonin, endorphins, enkephalins, and many others. The neurotransmitters, or the chemical messengers, bind to specific receptor sites on the dendrites of the next neuron, or the target tissue. Messages move throughout the entire nervous system in this manner. Impulses in the neuron are electrical. The impulses become chemical as the neurotransmitter is released at each synapse. The action potential becomes electrical again as they are picked up by the next dendrite of another neuron or by the target tissue. Changes in the amount of available neurotransmitters can cause different conditions. Neuroglia cells are found and support and care for the structure of neurons throughout the body. These specialized cells can perform specific functions on their own within the nervous system. There are several types of neuroglia, including Schwann cells, which help form the myelin sheath, which covers the axons of peripheral nerves. The astrocytes helps form something called the blood-brain barrier, which closely regulates what substances can enter brain tissue. Oxygen, water, glucose molecules easily pass into the brain, but many chemicals and other drugs do not. They're prevented from moving into the brain tissue. As I said before, it's one of the most tightly protected organs in the body. The microglia are found in the CNS. If brain tissue is inflamed or damaged, the microglia engulf and destroy microorganisms or debris. It's the central nervous system's own immune system. And the oligodendrocytes are found in the CNS. They myelinate the CNS axons and help fold nerve fibers together. An understanding of the autonomic nervous system is critical if we're going to further our careers at some point into either nursing, PA, or medicine, or other venues. The autonomic nervous system consists of nerves that regulate involuntary functions. Remember, autonomic sounds like automatic. ANS is an automatic system that regulates body functions such as breathing, heart rate, sweating, circulation, digestion, etc. It also controls the actions of muscles and blood vessel walls, organs, and glands. The motor portion of the system is further divided into the sympathetic nervous system and the parasympathetic nervous system. These are two opposing systems that help maintain homeostasis throughout the body systems. So the sympathetic nervous system can produce what we call the fight or flight response. This is the part of the nervous system that helps the individual respond to perceived stress, whether it be external, such as a grizzly bear chasing after you, or internal, such as a possible heart attack in progress. It speeds up the heart rate, raises blood glucose levels, raises body temperature, slows the digestive system, widens the bronchioles to allow more oxygen to enter the body quickly. It also stimulates the adrenal glands to increase their secretions. But you can't live in that state your whole life. So the parasympathetic nervous system opposes the actions, or puts what we call a braking action on this system. The parasympathetic nervous system does the opposite. It slows the heart rate, lowers the blood pressure, increases digestive function, reduces adrenal and sweat gland activity. Sometimes it's referred to as the rest and digest system as opposed to the fight or flight system. So some common disorders of the nervous system and common signs and symptoms of neurologic disorders include things like neuralgia, which is nerve pain, very burning type sensation, Paresthesia, or feeling of prickling, burning, or numbness. Spasms, which are involuntary muscle contractions, such as stuttering and tics, and tremors, which are rhythmic, purposeless muscle movement. Recurrent headaches, visual change, memory loss, which is referred to as amnesia. Difficulty speaking or finding the right word. Confusion, disorientation, or loss of consciousness. There are over 600 neurological diseases known at this time. The conditions discussed are grouped as neurodegenerative diseases, functional disorders, infections, structural disorders, and vascular disorders, pardon me. So neurodegenerative diseases affect a person's ability to move, talk, and even breathe. These diseases can also affect a person's balance and heart function. Etiology could be genetic, due to a medical condition, virus, toxins. Sometimes we just don't know what's going on or why these things happen. Take, for example, amyotrophic lateral sclerosis. It's otherwise known as Lou Gehrig's disease. Lou Gehrig was a famous Yankees baseball player from the 30s and 40s. We'll get to that later. It's a progressive neurological disorder that attacks the motor neurons in the brain and the spinal cord. It usually affects adults between 40 and 60 years of age. There's no known etiology or cause for ALS. They really don't know what causes it. They think there may be a genetic component in up to 10% of the cases. Early signs and symptoms include mild muscle problems, trouble walking, running, writing, later on even swallowing and speaking. The muscle weakness starts in the hands and feet and spreads throughout the whole body, leading to an inability to move the legs and arms. Eventually, the person has difficulty eating, speaking, and breathing. Quite often, people experience memory issues, but a lot of times they also stay quite alert. If you remember the noted scientist Stephen Hawking, he spent most of his life with this disease, confined to a wheelchair and paralyzed. But one of the greatest minds that ever existed on this earth. So there's no cure. Tests may be done to rule out other conditions like MRIs and electromyography. Sometimes physical therapy can be prescribed to prolong the onset of muscle weakness and atrophy. But once again, there is no cure. There are some medications that are being experimented with, but nothing's been found to be of any great use for this disease. The term dementia refers to several disorders, most common of which is Alzheimer's disease, although other causes such as vascular dementia from strokes, Lewy body dementia, and even AIDS-related dementia can occur as well. It's a name for a group of symptoms that affect the brain. Symptoms of dementia include being unable to do normal activities of living like eating, dressing, grooming, solving problems, controlling emotions. People with dementia need to have at least two more problems with brain function, either memory, language, recall. Most common of these diseases is Alzheimer's, which is the leading cause of dementia. There are other examples as well, as I mentioned before. So Alzheimer's disease is, like I said, is the most common form of dementia. It damages and kills brain cells. Usually begins after 60 and the risk increases with age. The risk also increases if you have a family history of family members who have had Alzheimer's disease in the past. Researchers believe that it's caused by a combination of lifestyle, genetics, environmental factors, all that affect the brain. Some research suggests a link between the herpes simplex virus, but no known cause just yet. The causes are not fully understood. The signs and symptoms begin slowly. Initially, a person usually has difficulty remembering recent activities or the names of people he or she knows. And it's not just a matter of misremembering where they placed their keys, it's more of a problem remembering what their keys are for. Over time, symptoms worsen, affecting the person's ability to speak, read, write, or even remember who family members are. Personality changes can occur, such as aggression, disorientation. A lot of times, these patients wind up wandering away from home and then can put themselves in danger. The provider will do a medical history and physical. There's no real specific tests for Alzheimer's. CTs, MRIs, PET scans, psychiatric evaluations. may be done, but those are usually done to rule out other issues. Some lab tests are done to, again, rule out other conditions that may be reversible. There are a number of different medications on the market, such as Aricept and Exelon. These affect chemicals in the brain called acetylcholine. But again, these medications don't cure the condition, they just slow down the progression. Huntington's disease is also called Huntington's chorea, which is a progressive neurodegenerative disorder. There are two forms: early onset, which begins in childhood or the teen years, it's least common, and an adult onset, which starts out in the 30s or 40s and more common. Usually people die within 15 to 20 years of diagnosis. It's caused by a genetic defect. If the gene is inherited from one parent, the child has a 50% chance of getting the disease. As the gene is passed through the families, the disease develops at an earlier age. Behavior issues are usually seen first and include disturbances, hallucination, moodiness, irritability, restlessness, psychosis, and paranoia. Abnormal movements can also occur and include facial grimacing, jerky movements, slow and uncontrolled movements, prancing gait. Dementia also sometimes occurs and affects memory, speech, and recall. The provider again will do examination and order additional tests, including psychological tests, MRIs, CAT scans, PET scans. Again, just like Alzheimer's, there's no cure. The goal of treatment is to slow the symptoms down. Palliative. Medications such as dopamine blockers may help to reduce abnormal movements, and sometimes muscle relaxants can be prescribed as well. Multiple sclerosis is an autoimmune, meaning the patient's own immune system attacks them, neurodegenerative disorder that affects the brain and spinal cord. The myelin sheath, the wrapping around the axon terminal, is damaged, leading to slow or blocked messages to the brain. MS often occurs between the ages of 20 and 40, affects women more than men. It can be mild, but some people may not be able to write, walk, or speak. There are 4 types of MS. There's clinically isolated syndrome. A person has an MS-like episode but does not really meet the criteria for diagnosis. There's relapsing remitting MS. This is more common. Person experiences relapse of neurological symptoms followed by periods of partial or complete remission or recovery. Then there's secondary progressive, which follows the initial relapsing remitting course. Some people eventually have worsening symptoms. And then there's primary progressive, which symptoms just take a slow, consistent downward turn from the onset. Person does not experience early relapses or remissions, they just slowly decline. Again, the etiology is unknown, though it's an autoimmune disease. Some risk factors may include family history, infection with Epstein-Barr virus, history of thyroid disease, type 1 diabetes, or inflammatory bowel disease. Corticosteroid medications may be given to reduce nerve inflammation, but just as all these others, there is no cure. We're probably more familiar with Parkinson's disease, which is a progressive neurodegenerative disorder that affects movement, like you may be aware of the actor Michael Fox from 80s and 90s movies. With Parkinson's disease, the dopamine-producing neurons in the brain gradually die. The dopamine levels decrease in the brain, leading to the symptoms. Parkinson's disease usually begins around age 60 and is more common in men. Once again, the cause is unknown, but genetics and environmental triggers, such as exposure to certain toxins, can increase the risk of the disease. Signs and symptoms include tremors and pill-rolling tremors, thumb and forefinger rubbing back and forth together like a person's rolling a pill. Bradykinesia, slow movement, shuffling gait, rigid muscles, impaired balance and posture, stooping and writing changes, loss of automatic movement such as blinking and smiling. Patients with Parkinson's disease tend to have what's called a masked face, facial appearance devoid of any type of emotion, and speech changes, often slurring or soft voice whispering. Sometimes they lose their sense of smell, a condition called anosmia, trouble sleeping, dizziness, and constipation. There can be very heat or cold intolerance and drooling. No specific tests provider will usually refer to a neurologist to do certain examinations and history. There are, again, medications such as Sinemet, carbidopa, levodopa, Requip, which help slow down the breakdown of dopamine, prolonging the onset of disease, prolonging the progression of disease, but do not cure it. Headaches are probably one of the most common form of pain experienced. Almost everyone's had a headache. There are different causes, including sinus issues and stress. Many times people will try home treatments first, such as rest and fluids and over-the-counter analgesics. It may or may not relieve the headache. People may be seen by their primary providers if the headache is severe or recurring. We'll talk about some of the more common headaches, well, and not so common. Cluster headaches occur in cyclical patterns, or what they call clusters. A person may awaken in the middle of the night with a headache on one side of the head. These headaches tend to be excruciating. May last for weeks or months, and then remission may follow. The etiology is unknown, but there may be an increase in the release of histamine or serotonin that causes the pain. Signs and symptoms include usually a severe, sudden, one-sided headache with tearing of the eyes, droopy eyelids, stuffy nose. Usually occurs about 2 to 3 hours before falling asleep. Migraine headaches are very commonly misunderstood. Most people think a migraine is just a severe form of an everyday headache, but it's actually a system-wide neurologic problem. They can affect children through adults. Causes may include stress, anxiety, hormone changes, bright lights, sleep deprivation, some types of foods, and they usually occurs in stages. First is a prodrome, or the earlier onset. May find the person having mood changes, food cravings, neck stiffness, increased thirst, maybe constipation. Then comes the aura, which may occur right before or during the migraine, where patient may experience visual, sensory, or verbal disturbances, hearing noises that aren't there, difficulty speaking, vision loss, and jerking. Sometimes these symptoms can mimic a stroke. And then there's the actual headache attack itself, which can last days, where a patient may experience a throbbing pain on one or both sides of the head, sensitivity to light and noise and smells, even nausea and vomiting can occur. And then the postdrome syndrome may cause confusion, moodiness, dizziness, weakness, and sensitivity to noise and light. Many different types of medications available for migraines. A lot of times it's a matter of hit and miss. There are medications that are considered what we call abortive, to stop it in its tracks. Or for a person that has frequent migraines, medications can be prescribed on a chronic basis as what we call prophylaxis to prevent them from happening in the first place. Then tension headaches are really the most common type of headaches. They occur when the neck and scalp muscles become tense. Usually stress, depression, anxiety, head injuries, and well, head injuries are a little bit different, can cause tension headaches. Pain and muscle tightness in the head, scalp, or neck, usually feeling like a band constricting the head, is what the patient complains of. Usually management with patient home remedies such as over-the-counter Advil, Tylenol, muscle relaxants. Sometimes the prescriber may send out antidepressants that are also used. Okay, so for those of you who've ever witnessed a seizure, you know that it can be a very, very scary ordeal and not know how to handle it. But what is a seizure actually? Well, seizure, or convulsion, but there's not always convulsions, it's basically just a sudden increase or disruption of electrical activity in one or more parts of the brain. There's different classifications of seizures. They go by their new terminology and old terminology. The more commonly, or the most well-known seizure is that what's called a generalized seizure. And this occurs on both sides of the brain, and it is formerly known as a tonic-clonic or grand mal seizure. And this involves first loss of consciousness, then what's called a tonic phase, which involves severe rigidity of all the muscles, followed by the clonic phase, which is the rapid jerking movements, the convulsions. It can last 1 to 3 minutes or even longer. It's usually preceded by an abnormal sensation called an aura, where a patient may have an unawareness that the seizure may be coming on. They may feel funny feelings, they may have abnormality in their senses, seeing lights, hearing noises. Then after the convulsion is a period of unconsciousness or unawareness called the postictal phase. And that can last several minutes to even hours. A focal onset or partial seizure, otherwise known as a simple partial or complex partial, involves the patient being awake, being alert during the seizure, and having some type of abnormal localized motor movement. Lip smacking, muscle jerking, twitching. And then there's seizures that are unknown. When the seizure began is not known, or seizure was not witnessed. These are oftentimes, we in the emergency room just make the assumption that a seizure was experienced based on how the patient's presented. There are a number of different things that can cause seizures. Anything from medications to high fevers to head injuries, certain diseases like meningitis, overdose on drugs. Provider, when evaluating a patient with a seizure, will do a neurological exam, may order blood tests to check for conditions associated with seizures, like electrolyte imbalance, for example. They also want to check for levels of anti-seizure medication, such as Dilantin, which needs to be monitored periodically. Additional tests would include electroencephalogram, EEG, which monitors brain waves, CAT scan, which is a 3D image of the brain, which is done more emergently, MRI, which does not use radiation, it uses magnetic waves to get a better, more accurate view of the structures of the brain, PET scan, which involves injecting radioactive glucose into the circulation to see the actual physiological activity, brain, and others. So we often commonly think of seizures being associated with epilepsy. Epilepsy is a disorder that causes recurring seizures. Person usually has to have 2 unprovoked seizures before epilepsy is diagnosed. And we basically call it epilepsy when we can't find out any other secondary cause of the seizure. The seizure is usually classified as generalized or focal. It can affect anyone at any age, and sometimes children can outgrow it. There are several causes, including genetics, brain injury, abnormal development, illness. Many times the cause is not known. It's referred to as idiopathic. The signs and symptoms are based on the type and can include confusion, staring, uncontrolled jerking, and loss of consciousness. As mentioned in previous weeks, the process of patient just turning blank, stopping what they're doing, and looking like you've just put the pause button on them is formally called a petit mal seizure, and generally happens in children, and most of the time patients outgrow it as they enter their adult years. Encephalitis is an inflammation of the brain tissue itself. There's many different forms. There's Japanese encephalitis, which is a viral infection that occurs in Asia and Western Pacific. Travelers can be vaccinated for prevention of this disease. La Crosse encephalitis, mosquito-transmitted viral infection that occurs in the upper Midwestern, Mid-Atlantic. And St. Louis encephalitis, mosquito-transmitted viral infection that occurs in the eastern and central United States. Encephalitis can be caused by a viral or bacterial infection. In a mild case, a person may just have flu-like symptoms, fever, headache. A severe case, a person may experience severe headache, drowsiness, vomiting, confusion, seizures, and a high and sudden fever. Babies may constantly cry, not eat well, have body stiffness, and bulging fontanelles, the soft spot in their skulls. After a physical and neurological examination, the provider may order a cerebrospinal fluid analysis, which requires a lumbar puncture, otherwise known as a spinal tap. Blood tests, CAT scans may also be done. Severe cases require hospitalization and intravenous medications to treat the infection and reduce brain inflammation. Bacterial infections usually require antibiotics. Some people have ongoing, lingering complications from encephalitis, such as speech and physical abnormalities, and may require physical and occupational therapy to resume their normal activities of daily living. So meningitis is the inflammation of the covering of the brain, these membranes called the meninges, which surround the brain and the spinal cord. Viral meningitis is the most common form. It's caused by a viral infection that affects the nose, mouth, and travels to the brain. Bacterial meningitis, which is usually a lot worse, is caused by pneumococcal or meningococcal infections. Starts with a cold-like infection that can be deadly. Meningitis vaccine can help prevent certain types of bacterial infections that cause meningitis. It doesn't prevent all. Meningitis can be caused by viral, bacterial, or even fungal infection. There's even non-infectious forms of meningitis due to simple inflammation and cancer-related meningitis. Remember, the suffix itis just simply means inflammation of. The symptoms may include sudden high fever, severe headache, stiff neck, or called mucorigidity, nausea, vomiting. This can also be what we call photophobia, avoidance of light. Bacterial meningitis can cause permanent damage such as hearing loss, brain damage, and even stroke. Physical and neurological exam, the provider will order blood tests, blood culture, imaging tests, and ultimately, would not be done in the office, it would be done in an emergency room, a lumbar puncture to test the cerebrospinal fluid. With bacterial meningitis, the patient usually receives IV antibiotics to treat the infection and steroids to reduce the inflammation. With viral meningitis, it's a matter of symptomatic treatment. Bed rest, fluids, analgesics are usually prescribed and monitoring. So some other objectives we're going to go over. Procedures of the neurologic exam, distinguish among neurological structural diseases, describe the types of strokes related treatments, discuss the medical assistant's role in the neurological exam, summarize the medical assistant's role with a lumbar puncture procedure, and summarize the patient coaching required for electroencephalography. If anybody's ever seen a Bell's palsy, it can be commonly mistaken for a stroke. Bell's palsy is the most common cause of facial paralysis. Symptoms typically affect one side of the face and are at their worst about 48 hours after onset. Although the majority of cases of Bell's palsy, the cause is unknown, most researchers believe that a viral infection causes facial nerve inflammation, herpetic infections, and it can also be a consequence of Lyme disease as well. The risk of Bell's palsy increases with pregnancy, diabetes, and recent upper respiratory infection or cold. Signs and symptoms include facial twitching, weakness, paralysis, drooping of the eyelid or corner of the mouth, dry eyes or excessive tearing, and diminished ability to taste. As we said before, this can very commonly be mistaken for a stroke unless a real accurate history and physical exam has taken place. So, usually with a proper physical exam, no tests are usually ordered. Sometimes the provider will order blood work to test for herpes antibodies and Lyme disease, but those are usually just kind of grasping at straws. Symptoms typically resolve in 2 to 3 weeks, but sometimes may take months to return to normal function. Some mild cases do not require treatment. However, sometimes the provider will prescribe steroids and antiviral medications. And one big issue is protecting the eye from injury, because sometimes patients don't have the ability to close their eye all the way, and so they need constant lubrication, maybe even a patch to protect the cornea of the eye. As mentioned before, the syndrome of shaken baby syndrome can cause traumatic brain injury without any direct impact to the head itself. Shaken baby syndrome is the leading cause of child abuse deaths. There are over 1,300 cases a year in the United States, and about a quarter of which the children will die. This occurs when a child is violently shaken or when the head strikes a hard surface, but usually from a frustrated caregiver shaking the baby uncontrollably. Crying is the leading trigger for the violence that leads to this situation. Most babies are less than 6 months old when it occurs. Signs and symptoms would include lethargy or extreme irritability, bruises, rigidity, difficulty breathing, bulging fontanelles, inability to focus the eyes or track movement, unequal pupil size, seizures, and poor feeding. If a provider does a fundoscopic eye exam, they can usually see retinal hemorrhages occurring, and that's a telltale sign that shaken baby has occurred. About 80% of children who survive have lifelong disabilities, including blindness, seizures, hearing loss, developmental delays, cerebral palsy, and severe mental retardation. The National Center on Shaken Baby Syndrome uses an acronym called PURPLE to help identify and take care of the possibility of shaken baby syndrome. So PURPLE, P-U-R-P-L-E. P stands for peak of crying. Crying may increase weekly until 2 months of age. Unexpected. A child may cry off and on, though the parent or caregiver may not know why. R. The child resists soothing. The child may not stop crying regardless of what the parent or caregiver does. P. Pain. Pain-like face. The child's facial expression indicates that she is in pain, though it may not be the situation. L. Long-lasting. The child can cry for more than 5 days straight. E. Evening. Crying may increase in the late afternoon or evening. Spinal cord injuries occur when a blow, a gunshot, stabbing fractures, or something else dislocates the vertebrae and the bone pieces cut into the cord or press on the nerves. Common causes include motor vehicle accident, falls, acts of violence, alcohol and diseases. Sometimes cancerous tumors can cause spinal cord injury without trauma. Spinal cord injuries can be either complete, where no signal can be sent below the level of the injury and the person is paralyzed below the injury. This is usually permanent. Or incomplete, where some signals can be sent below the injury and the person has some movement and sensation below the injury, and recovery may be possible depending on the timing and quality of intervention. Causes an injury usually to the vertebrae. This is a medical emergency. Initially, the person may experience extreme back or neck pain, incontinence of bowel or bladder, difficulty breathing, and paralysis. A person will wind up being quadriplegic, or a more common term now is tetraplegia, where the spinal cord injury affects the arms, hands, trunk, legs, and pelvic organs. Paraplegia involves a spinal cord affecting some or all of the trunk, legs, and pelvic organs. The emergency provider will perform a physical exam and neurologic exam. Imaging studies such as X-rays, MRIs, CTs will be done. X-rays are almost useless as far as determining injuries that may cause spinal cord functions. Most of the standard of care these days include performing an initial CAT scan and then possibly an MRI later on. Treatments include surgery, traction, steroids, and rehab. Peripheral neuropathy occurs as a result of damage to the peripheral nervous system. There's over 100 subtypes of peripheral neuropathy, each with its own symptoms. One of the most common causes of neuropathy is from diabetes. The cause may be inherited, acquired, or unknown. Acquired peripheral neuropathy can be caused by physical injuries such as sports-related trauma, diseases related to metabolic and endocrine disorders, as mentioned before, diabetes, peripheral arterial disease, some autoimmune diseases, and even Lyme disease, and sometimes exposure to toxins, including medications, industrial toxins, and heavy alcohol consumption as well. Signs and symptoms include tingling, numbness, paresthesias, weakness, or sometimes increased sensitivity to stimuli, burning pain, or what we call hyperesthesia, muscle wasting, paralysis, and organ dysfunction. With diabetic neuropathy, pain and numbness are felt in both legs with gradual progression up the legs. The provider will do a physical and neurological exam. Tests to be done include nerve conduction velocity, electromyography, MRI, nerve and skin biopsies. Treatment usually addresses the underlying cause and symptom management. There's many medications to treat this condition, including antidepressants, anticonvulsants, antiarrhythmics, narcotics, which are usually the last choice. Non-steroidal anti-inflammatories, or NSAIDs, may help ease neuropathic pain, but usually doesn't eliminate. Shingles, or what's also known as herpes zoster, can affect about 33% of all adults. Anyone who's had chickenpox can get shingles, including children. Usually it only occurs once, but every now and then it can redevelop. Vaccines are available to help prevent shingles, and basically it presents in a one-sided vesicular or rash that appears like little chickenpox bubbles along a nerve tract, or what we call a dermatome, and it can be extremely painful. It's caused by the varicella zoster virus, the same virus that causes chickenpox. After a person had chickenpox, the virus remains inactive in the body. It hides away in the spinal cord. It, for some reason, can reactivate, more often than not, due to some type of stress or trauma on the body. Beginning symptoms usually include uncharacteristic tingling, pain, or itching on one side of the body or wherever the dermatome is affected, usually on the torso. Patient may complain of this right-sided back pain and can't really figure out why or what happened. This occurs 1 to 2 days before a rash with fluid-filled blisters develops. This person is contagious to others who have not had chickenpox or the chickenpox vaccine until the blisters scab over in about 10 days. The rash will usually clear up in a month. The person may have a prodromal syndrome of viral type illness, pain, fatigue, mild grade fever. Sometimes not, though. Sometimes, though, this condition can cause what's called postherpetic neuralgia, where the person has chronic pain. There's no cure, but some antiviral medications may be ordered to help reduce complications and hasten recovery. Sometimes the provider will order certain types of pain medications because, as I said, this condition can be very painful and very debilitating at its worst. Spina bifida is a congenital condition, meaning something happens to the development of the fetus in utero, which causes a neural tube defect that occurs when the spinal column does not close during the first month of pregnancy. Spina bifida can cause damage to the nerves and the spinal cord. Pregnant women are encouraged to take folic acid during pregnancy to reduce the risk of spina bifida. Women are even encouraged to take supplements of folic acid even before they become pregnant if they're contemplating becoming pregnant. There's 4 types. There's spina bifida occulta, mildest form with no spinal nerves are involved, but one or more vertebrae are malformed. No signs or symptoms may be present. There's closed neural tube defect, which includes a malformation of the fat, bone, and meninges associated with the spinal cord. Symptoms range from no symptoms to incomplete paralysis and bowel and bladder dysfunction. A meningocele occurs when the meninges protrude through an abnormal vertebral opening, creating a sac. The sac is fluid. Symptoms range from no symptoms to complete paralysis and bowel bladder dysfunction. A myelomeningocele is the most serious type because the spinal canal is open along several vertebrae. A sac containing fluid, part of the spinal cord, and nerves comes through the opening in the infant's back. This type can cause partial or complete paralysis below the opening. The child may have weakness or paralysis of the legs, bowel, and bladder, and lack of feeling in the legs, and an increase in cerebral spinal fluid. Tumors of the brain and spinal cord can either be benign, or otherwise known as non-cancerous, or malignant, or cancerous. Um, and the problem is they can place pressure on the CNS and causing impaired function. As I mentioned before, that's one of the most non-traumatic causes of spinal cord dysfunction and paralysis. Um, tumors of the CNS can be caused by genetic diseases, radiation exposure, cancer-causing chemicals, but more often than not, cancer of the central nervous system is usually a result of metastasis or spreading of cancer from other organs like lymphoma or lung cancer. Signs and symptoms really depends on the tumor's location. Spinal cord tumors will cause pain, numbness, and paralysis. Brain tumors can cause seizures, nausea, vomiting, visual disturbances, hearing disturbances, headaches, behavioral changes, cognitive changes, and balance and coordination problems. Provider will do a physical and neurological exam and order the appropriate tests. Really, treatment depends on the type of tumor. Surgery, radiation, chemotherapy, corticosteroids. However, sometimes if the tumor is really deep within the brain tissue, unfortunately, not much can be done. A cerebrovascular accident is also known as a stroke, and it's either the fourth or fifth leading cause of death in the United States, depending on the updated resource that you read. But it's also one of the most major, if not the major, cause of permanent disability. Strokes can occur at any age, but they usually occur in older adults. It's a medical emergency. And bottom line is, one way or the other, a stroke is an interruption, one way or the other, of the blood supply to the brain. There are a few different types and subtypes of stroke. The most common type of stroke is called an ischemic stroke. This occurs when the arterial blood flow to the brain is blocked. The brain cells start to die after a few minutes. And then there's a couple of subdivisions of this type of stroke. A thrombotic stroke occurs when a blood clot forms in the artery itself, blocking the blood parts of the brain. The most common place for this to occur is actually in the neck by the common carotid artery, where the carotid artery splits off into the internal and external carotid arteries. And then there's an embolic stroke, where blood clot forms elsewhere, sometimes from the heart, and breaks off and travels to the brain artery, getting to a point where it can't pass anymore and blocks blood flow. This occurs about 80 to 85% of the time, so it's the most common type of stroke. Then there's what's called a hemorrhagic stroke. This occurs when the artery in the brain leaks or ruptures. The leaked blood puts pressure on the surrounding brain cells, causing damage. High blood pressure and aneurysms are risk factors for hemorrhagic strokes. Two major types of hemorrhagic strokes are one called intracerebral hemorrhage, where it occurs when a cerebral aneurysm ruptures and blood travels throughout the brain tissue with a very poor prognosis. And a subarachnoid hemorrhage, bleeding occurs in the subarachnoid space, usually caused by small aneurysms, and the prognosis for these are a little bit better. Then you also have what's commonly referred to as a mini stroke, which is more known as a transient ischemic attack, called the TIA. It's a mini stroke because it lasts only for a few minutes. So your patient typically has the signs and symptoms of a full-blown stroke, but it resolves on its own within a very short time. The textbook definition is less than 24 hours, but it usually resolves much quicker than that. There are many risk factors for stroke, including heart disease, family history, cigarette smoking, obesity, high cholesterol, hypertension, binge drinking. And there are many different signs and symptoms of a stroke as well. Confusion, speech difficulty, numbness of the face, arms or legs, usually on one side of the body, visual disturbances, trouble walking, lack of coordination, sudden severe headache, facial drooping, hemiparesis, which is weakness on one side of the body. The emergency department or the provider will perform a physical and neurological exam. If this is suspected in the office, which was mentioned last week, probably one of the most important bits of information to get from the family is the exact time of onset of symptoms. If that can be determined, then patient stands to have a good chance of receiving interventions that may reverse the onset of the stroke. So ischemic strokes are treated with clot-dissolving medications, what we call thrombolytics. They help the body break down the clot that's blocking the artery. There are also interventional surgical techniques that can remove the clot if needed, if they go past the point of qualifying for the clot-busting medications. Hemorrhagic strokes are a little more difficult. They're treated with antihypertensives, supportive therapy, sometimes surgical repair of the vessel. If the person's taking blood-thinning medications, they may have to be discontinued for a short time. Sometimes if there's a concentrated blood clot in the brain tissue, it can be removed surgically. However, if blood is spread out through the parenchymal tissue of the entire brain, it's a matter of time and rehab. TIAs are treated with evaluating all the risk factors, coaching to help reduce or eliminate the risk factors. Patient may also be put on antihypertensive, anticoagulant, and antiplatelet medications. The goal is to prevent a future stroke, because when a TIA occurs, patient has a 3 to 4-fold likely increase in risk of having a full-blown stroke within the next month. So it's a warning sign. So when you're talking about the medical assistant's role in neurology procedures, a big part is to assist with the examination. As with any other physical exam, careful history provides the provider with valuable clues in diagnosing neurologic conditions. These clues may include a record of seizures, syncope or fainting, diplopia, which means double vision, incontinence, loss of bowel or bladder control, or any of the mentioned subjective symptoms. Patient's general health is often complicates a neurologic diagnosis. As part of the medical history, the medical assistant may be asked by the provider to give and score a neurologic status exam, if this is within the scope of practice. This exam tests the patient's cognitive function and provides a baseline of neurologic information for the provider. Taking a careful history can help the physician determine the effect of symptoms on the patient's emotional, intellectual, cognitive well-being, as well as general behavior. These are all issues that most providers tend to not have time to assess. And also helping the patient to assume proper positions for all physical tests that have the instruments ready for the physician as well. The provider is going to do a neurologic exam, also called a neuro exam, to evaluate the functioning of the patient's nervous system. During the exam, the provider may determine the effect of the symptoms on the patient's emotional status. Parts of the physical exam includes mental status. The patient's level of awareness is assessed. Is the person aware of person, place, and time? Providers may ask people to state their full name, where they are, and what the date is. If the person knows these 3 things, the provider may document alert and oriented to person, place, or time, or simply A&O times 3. For neuro exams, it's always good to document what was asked and the patient's exact answer. The mental status is also assessed as the provider interacts with the patient. Is the patient's speech clear? Does the patient make sense when talking? There's a whole procedure on assessing the function of the cranial nerves. Motor function, balance, and coordination. Patient may be asked to push, pull against the provider's hands as the provider checks all the patient's extremities. You may have the patient walk or stand with his or her eyes closed to assess balance. You may be asked to walk normally or on the line on the floor. You may also have the patient touch his or her nose with the eyes closed to assess coordination. Sensory function may be tested by looking at the patient's ability to feel sensations by using sharp, dull, or light touch, as well as hot and cold and vibrating items like a tuning fork. Provider may check reflexes by using a reflex hammer. We'll tap the extremities in different locations. Newborn and infant reflexes are assessed during different stages of development. Different Reflexes may be observed with certain age groups. For example, Babinski reflex. This is when the foot is stroked and the toes fan outward. The Moro or startle reflex. With sudden changes in the position or with loud noises, the infant moves his arms sideways, the palms up and thumbs flexed, although I think this is kind of cruel to do to an infant. And the palmar grasp. When the finger is placed in an infant's palm, the fingers grasp it. So the medical assistant's role in the neuroexam will differ among agencies and facilities. The medical assistant may need to set up for the exam. Some providers may have the medical assistant remain in the room and assist by handling supplies, handing over supplies, and helping the patient change into positions. Medical assistant may also be asked to document the provider's finding during the exam. The medical assistant also assists with diagnostic procedures by scheduling and preparing patients for procedures. If test requires restrictions on food or fluids, the medical assistant should address the following points and coach the patient appropriately. Talking about the following points: can the patient have water prior to the test? Which medication should the patient take prior to the test, or which should they hold off on? Medical assistant may need to screen patient for specific allergies to medications, to contrast dyes, or any other materials. And for some procedures, such as a lumbar puncture, a signed consent form may be required. Different types of neurologic screening procedures include the following. Cerebral angiography. This is used to see how blood flows through the brain. Person must lie on the x-ray table without moving. The head is held still. A local anesthetic is given in the groin area, and a catheter is threaded through an artery in the groin vessel until it reaches the neck. So it's important, again, to screen for allergies to make sure not allergic to the anesthetic. X-ray is used to help guide the process. A dye is injected and highlights the blood flow through the brain. The medical assistant can help by screening the patient for bleeding problems or taking anticoagulants, making sure they're not pregnant. Food should be withheld for 4 to 8 hours. And explaining to the patient that they may feel a brief discomfort during the anesthetic injection and the threading of the catheter. It's usually not that painful, though. The contrast dye itself may cause a warming or burning feeling or facial flush. Next test would be a cerebral spinal fluid analysis, which is usually performed via lumbar puncture or spinal tap. And this is used to determine any abnormalities in the cerebral spinal fluid, such as infection, high levels of protein, high levels of glucose. The procedure is performed by the provider. An anesthetic is usually given locally, and a needle is inserted in between the lower vertebrae, and then the CSF is sent to the laboratory. Again, medical assistant's role would be to screen for bleeding problems or taking anticoagulants, helping the provider put the patient in the proper position, handing the provider over the appropriate tubes and materials as the procedure is being done, and so on. And electromyography is used to test the health of nerves and muscles. A fine needle, almost like an acupuncture needle, with an electrode is inserted into the muscle. The electrode picks up the electrical activity from the muscle during activity and at rest, and then is recorded and evaluated. Once again, screen if the patient is taking anticoagulants. Coach the patient on avoiding using creams and lotions on the skin that day, and make sure they have normal body temperature. Explain to them that they may feel insertion of needles after the test. The muscle may be a little bit tender and maybe a little bit bruised. This is all normal effects. A nerve conduction velocity test is usually done with an EMG, done to test the speed of electrical signals as they move through a nerve. So electrode patches are placed on the skin over nerves and give off mild electrical impulses and recorded by other electrodes. Things to consider is the patient has a cardiac defibrillator or pacemaker. Patient should, again, avoid any topical applications of lotions before the procedure. And usually the procedure doesn't provide any discomfort, but the medical assistant should let the patient know to advise if they do feel any discomfort. A nerve biopsy involves removal of a small piece of nerve for examination. After applying an analgesic, the provider makes a small surgical incision and removes a piece of the nerve from either the ankle, forearm, or rib area. It's no really special preparation. Again, screening for reactions to local anesthetics, and let the patient know they may be sore for a few days. As mentioned before, a lumbar puncture, is also known as a spinal tap, is done to collect small amounts of cerebral spinal fluid, or we'll just say CSF. Uh, One, to measure the pressure of CSF and to inject medication into the spinal cord structures, and also to analyze what's going on with the CSF. Medications may include spinal anesthetic for surgery, chemotherapy, or contrast dye. In ambulatory care, the most frequent reason for an LP is to obtain a sample of the CSF to analyze and help confirm or rule out many diseases, including meningitis, encephalitis, cancer, or dementia. In preparation for the procedure, the patient should be asked if he or she is taking medication or herbal products that may increase the risk of bleeding, and obviously ask about any known FDA-approved anticoagulants. Even supplemental medications like garlic, ginger, St. John's wort, and ginseng, vitamin E supplements can all increase the risk of bleeding. The patient may be restricted from eating or drinking 3 or more hours prior to the procedure. The provider will explain the procedure to the patient, and a consent form will be signed prior to the procedure. The patient should be placed in either a left-lying position with the knees drawn up to the chest, somewhat like in the fetal position, or in a sitting position leaning forward on a table surface in a curled forward position. For an infant or young child, the medical assistant might need to hold the child in side place during the procedure. So the site is usually cleaned with an antiseptic, and a local anesthetic such as lidocaine is injected into the numb the area. The provider then inserts a hollow needle between the third and fourth, or fourth and fifth lumbar vertebrae, and advances it into the subarachnoid space. When done properly, there's no risk to damaging the spinal cord because the spinal cord ends between the first and second vertebrae. The fluid flows out of the needle into the sterile collection tubes. Usually 1 to 2 milliliters are collected in each tube, and multiple tubes, usually about 4, are collected. The tubes need to be numbered in the order that they are collected. The needle is removed and the bandage or small dressing is applied to the site. After the procedure, the patient typically needs to lie down for about an hour and drink a lot of fluid. If they get up too fast, they can get a severe headache. If more CSF is removed, the patient may need to lie down for a longer period of time. Prior to leaving the ambulatory care facility, the provider will check the insertion site and assess if the patient has any issues like problems moving the leg, numbness, tingling. The patient should not drive and may need to remain home for the rest of the day. Electroencephalography, or EEG, is used to record the brainwave activity of a patient. An EEG may be done to rule out or confirm seizure activity, psychosis, attention deficit, narcolepsy, and even sleep disorders. And it does so by recording changes in electrical impulses in various areas of the brain by means of electrodes placed on the scalp. Irregular delta waves are abnormal in awake adults. Slow rhythmic, what we call theta waves, show a decrease in brain activity. The medical assistant should coach the patient on the preparation for an EEG. In preparation for the procedure, patients should wash their hair the evening before or the morning of the procedure. They should not use any conditioner or hair care products. These products can interfere with the electrodes adhering to the scalp. Providers may have patients hold or not take certain medications before the test because they may interfere with the EEG readings. Patients should avoid consuming any caffeine on that day of the test. The EEG requires patients to sleep during the test. Providers may encourage them to limit their sleep to 4 or 5 hours the night before. The medical assistant should greet the patient by introducing themselves, explain the procedure or the purpose of the EEG and why it's being done, tell them how the EEG works by picking up tiny electrodes from the body, explain to them that it is painless, and go over the physical preparation of the procedure. During the procedure, the patient will be relaxing in a bed or reclining chair. The technician will apply about 16 to 25 electrodes to the scalp, either with a cap or paste. The wires from the electrodes bring the electrical impulses to the computer. The electrical activity in the brain is then recorded. The technician will record the brain activity while the patient is at rest or asleep, and with activities and stimuli such as bright flashing lights. can take anywhere between 45 minutes to 2 hours. Once the test is done, the electrodes are removed and the paste is removed with warm water. The patient was given a sedative. No driving is allowed after the test. Mild skin irritation may occur for a few hours of the test, but it's usually pretty benign. Patient should be informed of when to restart any medications and when to anticipate the test results. And before the procedure, you should always ask the patient if they have any questions and document the record appropriately. And during the course of examination treatment, the medical assistant may be asked to assist with the administration of certain types of medications and other treatments. Just some of the more common medications that are used in the field of neurology are analgesics, which are used to relieve pain, anesthetics, used to produce either local or general anesthesia, anti-Alzheimer's, obviously used to treat Alzheimer's disorder, anticonvulsants, used to treat neuromuscular disorders and epilepsy, antidepressants, used to treat depression, anxiety, and other issues such as chronic headaches or neuropathic pain, anti-migraines, there are many different types available, used to treat migraine headaches, and corticosteroids, used to treat chronic inflammatory and some autoimmune disorders like multiple sclerosis. So with neurologic disorders, patient needs to take medications daily or several times a day. With the symptoms of the disease, remembering can be difficult for some patients, so the medical assistant may need to help patients figure out strategies to remember taking their medications. Some methods may include things like placing medications near the kitchen table if they need to be taken with food, making sure they always keep it out of reach of children. Get into a routine and always take the medications after doing a specific task, like feeding the dog or brushing their teeth or taking a shower. Using technology, alarm clock on a phone, clock or app to remind them about medication times. Have a family member call to check if the medication was taken. Cross out the day on the calendar after taking the medications. Use weekly pill boxes. Some pharmacies will help set up the pill boxes, otherwise have a family member help and set it up weekly if needed. Medical assistant should also provide patient directions in writing about what to do if medication was missed. Should they double up the next day? Should they just wait until the next day? Can they take two after a few hours of missing their dose? Everything is different. So in neurology, you'll be faced with a variety of behaviors and personality changes that frequently are part of these conditions. Often a patient's not aware of these changes and may act as though nothing is wrong. It's important for the medical assistant to remember to treat patients with dignity and respect. All patient information, including pictures, audio recordings, and so on, are confidential. Remember your HIPAA guidelines. The medical assistant must also remember not to repeat information or gossip to peers about the patient's actions and behaviors. Only staff immediately involved with the patient have the right to the information about the patient care. And just as always, with many chronic neurologic diseases, the patient may require a caregiver to assist with daily care, such as toileting, bathing, grooming, meal preparation, shopping, and medical appointments, and so on. As the condition worsens, more burden falls on the caregiver. In many situations, the caregiver is a spouse or a significant other of the patient. Sometimes it may be an adult child. Providing 24/7 care to a loved one is physically and emotionally taxing. With behavioral differences and increasing dependency, relationship roles take on a change, and stress can affect the caregiver's health. It's important for the caregiver to remember to take care of themselves as well, and maybe a job of the medical assistant to remind the caregiver to reach out for help if they need. So the medical assistant needs to recognize the importance of the caregiver in the patient's life. The caregiver's concerns are important just as the patient's concerns. Medical assistant may need to provide the caregiver with emotional encouragement and resources for additional assistance, including home services, social work, adult daycare, medical equipment, and support groups. And as always, if any questions, please bring to class or post in the discussion board. Thank you.